So we did a survey last year where we tried to evaluate the knowledge and the attitude towards gene therapy in patients amongst physicians that were trained to take care of patients, and we divided this hematology into three separate groups. We had those that were specific in taking care of patients with sickle cell disease. We had those that were generalists, and then we had those that were transplant physicians. And the one thing we noticed is that the transplant group and the sickle cell group were both prepared and had more knowledge compared to the general hematology oncologists. But the most important thing is that enthusiasm was high. Almost 98% of those physicians were ready to discuss it. But like I said, those that were generalists didn't know necessarily the difference between the different products. They were kind of their knowledge about the long-term complications of gene therapy or the long-term outcomes of gene therapy in sickle cell disease was a bit lacking compared to hematologists that were sickle cell focused or transplant focused. So that was kind of like where the big differences were. But one thing I was certain is that everybody wanted to offer this to their patients.